Hi everyone, welcome. Today we'll be discussing the fundamentals of laser in dental hygiene. We'll cover the different types of lasers, how they interact with the tissue, safety protocols, and how they can be used in periodontal therapy. Hopefully by the end of this presentation, you'll have a clear understanding of how lasers enhance clinical outcomes in dental hygiene. Before we dive in, here are the key objectives for today's presentation. We will explore the different types of lasers used in dental hygiene, the basic principles of laser tissue interactions, proper safety protocols for laser use in clinical settings, the suitability of laser therapy for different periodontal conditions, non-surgical periodontal therapy used in diode, and then the outcomes of laser therapy in stimulated patient cases. Let's start by understanding what a laser is and how it works. So, laser stands for light amplification by stimulated emission of radiation. It is a device that generates a concentration beam of light energy, which can be used in a variety of medical and dental appliances. Specifically in dentistry, lasers are used for soft and hard tissue procedures, bacterial reduction, and even sometimes teeth whitening. Lasers work by delivering energy to the tissue, which can cause cutting, coagulation, and bacterial destruction depending on the wavelength and power setting used. So there's several types of lasers used in dentistry, and each one has a different application. These are the most common types, which is the diode laser, CO2 lasers, the ER-YAG lasers, and the water laser. The most common used laser in dental hygiene is the diode laser, which we'll discuss in more detail later on. So the CO2 laser primarily is for soft tissue. It provides coagulation, it's most effective for hemostasis, and precise cut can easily damage the soft and hard tissue because of the wavelength, it's easily absorbed. Then we have the ER-YAG, which is strongly absorbed by water. It's not good for hemostasis, and it's good for cutting bone, not so much for soft tissue. And just a little review for soft tissue versus hard tissue. Hard tissue is like bone, and soft tissue is like the gums, all of that. And then we have water laser, which is water energy laser and air and a water handpiece. Cutting bone like iridium, but with added benefits of waters, so dental nerve and thermal damage is significantly reduced. And lastly, we have the diode laser. It's the most common type of laser in dental hygiene. It's used for minor soft tissue procedures. It has high absorption rate for good homeostasis. Can be used around implants and crowns. It's mainly used for the soft tissue. It can be used in perio, teeth whitening, desensitizing teeth, and hepatic ulcer lesions. Here's what the diode laser looks like. There's many different brands out there, but this is what we kind of used in school. It has the soft tissue whitening. Usually you'll be in this setting and then you'll go to the perio setting. This is the tip of the laser. Usually this can get bent, so you can get into the pockets a little bit easier. This handpiece here gets twisted on, and this is a part that can get sterilized along with the tip. And it has a pedal as well. Same thing here. This is kind of what we use in my practice. It's the Sol diode laser. Same thing, here's the handpiece. You have these tips here, they get inserted there. These are already pre-bent, so you don't have to worry about bending them. And these tips are disposable, so once you use it, you can throw it away. And then you press this button here to start it. and it usually has like a light here, and it shows you what kind of setting it's on. Here's the petal. These are the glasses that you will wear when using them, but just wanted to show you what it kind of looks like. So, soft tissue indications for laser. This is kind of a little bit outside of dental hygiene, but the diode laser is useful for in a variety of soft tissue procedures, including gingivectomies, periodontal treatments, frenectomies, removing ulcers, gingival contouring, crown lengthening, soft tissue lesion removal. These procedures are more precise, less invasive, and can lead to faster healing compared to traditional methods. So the laser is used in dental hygiene to decontaminate the pockets that we are working with. So it's reduction in bacteria and byproducts that result in periodontal disease progression within the periodontal pocket. There are two types of pocket decontamination that hygienists usually regularly use. We have LBR, which is laser bacterial reduction, and it's the use of lasers to target bacteria in the periodontal pocket. LAPT is laser assisted periodontal therapy, which is a non-surgical approach to treating periodontal disease. So just a little why we use the laser. It's basically bacteria living in the tissue. So traditional periodontal therapy, so anything like gingival scale or a SRP, we are usually, removing everything that's on the tooth. Like in this image, we remove all the bacteria that's in this tooth, and sometimes when the tissue is really diseased, part of the tissue comes out of there as well. But as we can see here, bacteria still is living inside of the tissue, and of course we cannot gingivally curettage. So how do we treat the tissue? Because we removed everything that's on the tooth, but we want to get rid of the bacteria that's in the tissue. This is where laser comes in. It'll reduce the bacterial load by penetrating into the gums, and this leads to better healing by promoting tissue regeneration, because the tissue is getting kind of like burned, so it has to kind of refix itself, and kind of reducing the bacterial load. It reduces inflammation by eliminating bacteria and decrease the immune response. Improve long-term. Oh, sorry guys. I don't know how I can't go back. Okay, I cannot go back to the other slide, and I don't want to restart the presentation. But basically, it's we'll just move on to the next slide. This is laser bacterial reduction. It's used to reduce bacteria in gingivitis patients. It kills periodontal infections before they have attachment loss. So usually 3s and 4s patients with lots of bleeding everywhere, this is where you want to use it. You use the diode laser in the setting of 1 to 4 or 1.4 to 1.6 watts. You don't need anesthetic for this. It's pain-free, and the tip of the laser is uninitiated. Then we have, the goals that we want to see when we use the laser for these kinds of patients. One thing with LBR, you can also do it before you start scaling in a gingivitis patient. Usually you do this to reduce the bacterial presence before scaling, so making sure like in the aerosols there's not a lot of bacteria just floating around when we are scaling. It prevents bacteria from spreading to other areas during treatment. It helps the immune system by reducing the bacterial burden that it has with all the bacteria in the tissue. And then it enhances healing and reduces post-treatment inflammation. And and it can offer an adjunct to periodontal therapy without cutting or removing any tissue. Then we have laser-assisted periodontal therapy, known as LAPT. It's used as an adjunct to SRP. So there's already attachment lost. It's when the patient has active periodontitis. It can also be used if later on the periodontal maintenance. Either you can use LBR, but the difference is that if you do use LAPT on a perio maintenance, you have to make sure that the patient is numb. The setting that you would use for this is a little bit higher, so it would be for 0.4 to 0.6 watts, and anesthetic is needed and tip is initiated. We'll go into a little bit more how to initiate the tip. Here are the goals. We want to reduce the bacterial load. We eliminate the bacteria that's in the pocket, like in the tissue. We selectively target and remove the diseased epithelium while preserving what is healthy. We stimulate healing. We want reattachment of the gingiva to go back on the tooth. And then we minimize inflammation by reducing bleeding, swelling, and discomfort by decreasing the bacterial toxins. And we improve long-term periodontal health by creating an environment less conductive to bacterial recolonization. Okay, this is effective and safety delivery of laser. So we have to prepare the patient. These things you want to do every time you are going to use laser. You want to explain the procedure, the benefits, the risk. You want to make sure there's no medical contraindications, which I'll go over later on. We want to have a signed consent form. Whether it's in your practice, wherever it's at, you want to make sure a consent form is signed. You want to, before you start, you want to make sure that there's everyone's wearing the laser appropriate goggles, and you can put a laser warning sign. I know in school we had to put a sign outside of our op if we were using it. The laser setup, it's you just make sure that the tip is properly placed, that the pedal is ready. Usually the beam will light red and it will let you know that the tip is inserted correctly. You'll make sure that you apply the laser with proper technique, keeping the tip moving to prevent overheating the tissue. You'll use a saliva ejector or the HVE to suction throughout the procedure, because a little bit of smoke sometimes does come out, but also it just helps with the procedure. And then post-treatment, I usually get to let my patients know what to expect, especially after a SRP. What should they expect after that? And then when you're writing your notes, make sure you put the settings, the treatment that you did, if anesthetic was used. And I would usually see these types, my patients, 3 to 4 months, depending on what kind of cleaning we need. If you need to see them sooner, you can schedule 4 to 6 post-op. Here is the technique to how to use the laser. So for the laser bacterial reduction, the laser is used non-initiated mode. So what that means, the tip is not initiated, so no cutting is going to happen, and we move the fiber in a slow sweeping motion within the sulcus to reduce the bacterial load. You really want to focus the tip on the gum, not so more on the tooth. You want to make sure that it's like rubbing on the gum itself in the pocket. You want to keep the fiber 1 to 2 millimeters from the tissue surface for bacterial decontamination. You want to have the suction on all times and have it near the tip. For laser-assisted periodontal therapy, you insert the tip fiber into the periodontal pocket, activate it, and in the initiated mode to remove the infected epithelium. So in order To initiate it, usually use the articulating paper or a cork that usually is there. And once you initiate it, you'll start to see smoke coming out of the tip when you do touch the paper or the cork, and it usually turns the very tip of the laser black. And then you will lightly contact in the sweeping motion on the tissue, same thing, sweep on the tissue and work in short controlled strokes. Keep in mind that you are using a pedal when you are using it, and then you don't want to keep the tip or push down too hard because you can cause damage to the pocket, and as well have suction at all times. I usually let my patients know when I am using LAPT that there might be a smell of like burning. They're usually numb, they don't feel anything, but just to give them a heads up and so they don't freak out in your chair that they smell burn. Here is a video. This is a super helpful video on the techniques on how to use the laser. So I will want you guys to watch this video so you can get a better understanding of the technique, and also you can see the laser itself and the settings.
Now, I used to think that the laser in hygiene could only...
Okay, I'm going to move on here. Contraindications for laser. So patients on oxygen therapy, we don't want to, usually they have, a tank that they carry with. We don't want to cause any, what do you call it, like combustion. So making sure, thorough medical history, but if you see someone on oxygen therapy, it's a, fire hazard. Pregnancy, I would ask the patient if they are comfortable with using the laser. Immunocompromised patients. And then for any cancer patients, we would want to consult with their oncologist before any use of laser. And you always want to treat your patients on a case-by-case basis. Always evaluate each patient individually before using the laser. Fire hazards, so anything with tanks, alcohol wipes, making sure that you are not disinfecting the laser with any alcohol, because it can catch a fire and it will start real quick if the laser is on and the tip gets pressed on accident, like if you press on the pedal or something. Usually it does have a safety, the pedal has a safety block, so it won't press on its own, but just be really careful. Usually when you're done using the laser, right away go ahead and turn it off and be done with it. Same thing for any nitrous. We offer a lot of nitrous in our office, so that's a big contraindication for it could cause a fire just because there's oxygen and all of that, so make sure none of that is near. Okay, so now that we know like what the laser is and kind of what it does, here is a patient case scenario. I want to apply what we've learned, so I would want everyone to get into a small group and review this periodontal chart. Would you use this laser for this patient? What settings would be appropriate? What would you use? Would you use LBR or LAPT? I want you to discuss your recommendations with your group. Here I would have, everyone turn to each other and kind of go over and see, and then we would discuss as a whole class and see what everyone thought. Here's another scenario. Here is more, the previous one was more like a healthier, just localized bleeding on a few areas. Here is more of an SRP patient. Here I would hope my groups would talk about LAPT and propose, a deep cleaning, an SRP with the laser. Here is another one. This is more of a gingivitis case. I would recommend LBR here. So I would hope that they would talk about LBR. Okay, now we've all come back. So what are the clinical outcomes of laser therapy? What do we expect? We would expect, for reduction in the pockets, decrease in bleeding and inflammation, improved tissue regeneration and healing. If you have patients, let's say a SRP patient that comes back after we've done the SRP and we use the laser, but they still come back with no improvement, it is possible to use the laser again. You can use it in LBR or LAPT. Part of the problem is just multiple factors, but don't be scared to repropose, if we can use laser or maybe something, other options, but it's still an option. Don't feel like you only have to do it once and you have to be done. So here, laser therapy and dental hygiene, it's advancing periodontal care. It gives us other options to give to the patient if traditional, SRP or gingival scales are not working. Lasers enhance periodontal therapy by reducing the bacteria, inflammation, and pocket depths. We went over, the different types of lasers and the applications they have to dental hygiene, proper safety protocols, the difference between LPT and LBR, the techniques that it's used and how to use them correctly. Laser therapy leads to faster healing, less discomfort, and improved long-term health. One thing to keep in mind is just, when you're presenting to a patient that you want to use laser therapy, when you are having, that you want to use it, some verbiage that I like to use with my patients is kind of like I go in and remove all the bacteria that's sitting on your tooth, so all the calculus, and I show them like a picture of calculus on their teeth or something, and I say, then we have laser that kind of comes in. It's like heat therapy for your gums to remove that bacteria that's still residing in your gums and causing, periodontal disease or gingivitis or periodontitis, whichever one it's in the case. And they're kind of like, oh, okay, that makes sense. Thank you. I hope you guys enjoyed my presentation. Here's a little, meme. um, Now for the class activity, I will have you guys play this Kahoot. If you want to scan the QR code or have the link here. But yeah, let's get started with this Kahoot.